over the cranial nerves. Cranial nerve 1 is just a smell. Cranial nerve 2, which is the ophthalmic. Cranial nerve 3, which is the ocular motor. Cranial 4, which is the trochlear. Cranial nerve 5, which is the trigeminal. Cranial nerve 6, which is the abducens. Cranial nerve 7, which is the hypoglossal. Cranial nerve 8, which is the hearing, and cranial nerve 9, which is the pharyngeal nerve. Cranial nerve 10, which is the vagal, and cranial nerve 11, which is the spinal. Do you have any questions for me?
No.
Okay. Next, I'm going to move on to my cardiovascular assessment, and then I'm going to move on to, I'm going to do more some skin, okay? My cardiovascular and lung assessment. So first, I'm going to inspect can you look straight at the camera for me? Inspect your posture. Make sure you're sitting upright. Make sure you're not having difficulty breathing. I'm going to do my lung assessment first. Take a deep breath for me. See how the chest rises and expands and expands when he breathes. You say you don't have any difficulty breathing. The shoulders are symmetric. I'm then going to listen to your lungs. Excuse me. Take a deep breath. I'm going to list their anterior and posterior. Take a deep breath. Okay, so I just listened to the lungs anterior and posteriorly. I was listening for any crackles, wheezing, any fluid. I didn't hear anything. I hear clear breath sounds bilaterally. So then I'm going to palpate. Can you sit up for me, please? Palpate the lungs and the chest area. And I'm also inspecting, looking at the skin as well. Looking for any redness, swelling, inflammation, any pain or tenderness.
No.
The skin is warm, dry, and intact. I see no redness, no swelling. Any pain?
No.
I'm going to do a test called tactile furnius. I'm going to put my hand here and say 99. Okay?
99. 99. 99. 99. 99. 99.
And again, I'm going to inspect the back. Make sure I don't see any lesions, any discoloration, any bruises. Skin is warm, dry, and intact. I already listened to the lungs. I hear clear breath sounds. And again, I'm going to do the same test. Can you repeat 99?
99. 99. 99. 99. 99. 99. 99.
Then I'm going to palpate the lungs. And I'm going to go in between the ribs. Any pain?
No.
Then I'm going to check for thoracic expansion. And I'm going to percuss the lungs. Can you sit up? And I'm going to test for vibration. Can you turn around for me? I'm checking for any hollow sounds, renaissance sounds. And that's when I heard the sound change. So I'm gonna take a deep breath in, and I'm gonna percuss until I hear the sound stop. You still holding in?
Yeah.
Okay. And then breathe out. You're gonna take a deep breath in and breathe out and hold it, okay? Hold it. So the thoracic expansion right here is for this side. And do the same for this side as well. I've already marked the first one up here. Alright, and that side mark. So the thoracic expansion for you would be right here. Again, I'm inspecting the back, no lesions, anything like that. So that is my lung assessment. I inspected, auscultated, palpated, and percussed the lungs. I'm going to have you stand up and turn around. I'm just checking the time of the video. Can you sit down for me, please? Next, I'm going to listen to your heart sounds, okay? I'm going to listen to the heart sounds. I'm going to listen to the aortic valve, which is I'm listening for S1, S2 sounds, and it's in the second intercostal space. Listening to the pulmonic valve as well for S1, S2 sounds in the second intercostal space. I'm listening at Erb's point, which is in the third intercostal space for S1 and S2 sounds. I'm going to listen to the mitral valve. And I'm also going to listen to the tricuspid valve. And then I'm going to listen to the apical pulse, which you would hold for a full 60 seconds. I'm listening for any heart murmurs, any skipped beats, which I do not hear any. And I'm listening for a whole 60 seconds. And also for the cardiovascular system, I would palpate the pulses. First, I would palpate the temporal artery, and I'll palpate one side at a time, and I'll palpate for 60 seconds. I would then palpate the femoral artery, and it's important with the femoral artery, if you palpate, you don't do both at the same time. And I'll listen to that for a full 60 seconds. And then palpate the brachial. And then I'm palpating the radial pulse. Now again, palpate for 60 seconds. Again, I'm going to palpate the brachial pulse, and I'll palpate the radial. And I feel a bounding pulse, a +2 pulse, which is a normal pulse. Can you say that for me? So therefore, I listen to the lungs, listen to the cardiovascular system, the heart sounds. I didn't hear any murmurs. Listen for S1 and S2 sounds. Palpated the temporal. Excuse me, that was not femoral. That was I palpated the carotid artery. I apologize. This is the carotid artery. I palpated that for 60 seconds. Then I palpated the brachial artery and the radial artery. Then I would palpate the femoral artery, which is right here, and I would palpate that for 60 seconds as well. And I would palpate the popliteal artery, which is in the back of the knee, for 60 seconds. And then I would palpate the posterior tibialis pulse. And I would again hold that, which is in the back of the ankle, inside the ankle for 60 seconds. And then I would palpate I would palpate the dorsalis pedis pulse, which is on the foot, and I would palpate that for 60 seconds. Okay. And then I would do both sides bilaterally. Okay, next I'm going to have you lay on the floor, and I'm going to do an abdominal assessment on you. And you're like supine on your back. I'm going to move the camera down. Next I'm going to inspect the abdomen for any stretch marks, which I do not see any striae. Looking at the umbilicus, noting the size, making sure there's not any discharge, which I do not see. Then I'm going to listen to the abdomen sounds in each quadrant, which I see hyperactive bowel sounds. And I hear hyperactive bowel sounds in each quadrant. Again, I would auscultate after I inspected. I already inspected. I don't see any stretch marks on the skin. I already inspected the umbilicus. Like I said, I heard hyperactive bowel sounds in each quadrant. Then I'm going to move on to palpation. I'm going to palpate. Well, actually, I'm going to listen, to the radial artery. The iliac artery, and then I'm going to listen to the femoral artery, then I'm going to move on to palpation. I'm going to palpate the liver. Do you have any pain or discomfort while I'm doing this? And then palpating the spleen. And then I'm going to palpate the kidneys. Any pain?
No.
I'm just palpating the abdomen in general, see if there's any pain or tenderness. Then I'm going to percuss the liver. And I'm going to percuss the spleen. Okay, so that is my abdominal assessment. I inspected, I auscultated, I palpated, and I auscultated. So then I'm going to move on to my musculoskeletal examination. I'm going to have you sit back into the chair. At this time, I'm going to scan the room. So next I'm going to move on to my musculoskeletal examination. I'm going to inspect the muscles. Can you sit up for me, please? I'm going to inspect to make sure that one side is not higher than the other. Can you keep your arm out for me? I'm going to palpate the muscle. Very good. And then in my exam, I forgot to inspect the fingernails. Can you keep your hands out for me? I'm going to inspect the fingernails for any clubbing, any signs of cyanosis. I'm going to inspect the nail beds. No swelling, edema. Can you close your fist? Can you make a fist? Open up.